homeopathy, there is a phrase, one man's meat is another man's poison. As a doctor, as a practitioner, as a researcher, every medicine that I today put up on social media and say, I use this, I've used it for years. I have home food all throughout. मेरे घर में बाहर से पिज्जा नहीं आता. Stop taking any form of alcohol. Stop it. Stop it right now. It's having that alcohol in the evening when you should not be having anything post 7:30. 7:30 should be your last meal. I've seen 60-year-olds give up smoking at the age of, let's just say, 62, 63, 64, 65. And by that time, you've ruined all your health. I asked teenagers in my clinic, why are you doing this? What is it bringing you? He said, I just feel like I can be a part of a group. I can be a part of a cliche if I do this. If I have a vape in my bag, I look a certain way. I feel more confident.
First of all, Dr. Taniyaa, it's the pleasure, utmost pleasure of AP Podcast to have a person like you here. I guess first of a kind from a medical field. So really, really thank you for being here.
Thank you. The pleasure's all mine. Thank you.
So, when we talk about medical profession, it's so complex, it's so deep that one cannot be, having the first question to ask because it consists of so many things. You just cannot, just take out one thing and then ask it because there are several other branches attached to it.
Yeah.
But for the starters, let's start with something very basic so that the people can get acquainted with things that they should know. There's various so-called YouTubers, healthcare freaks who come and they said they can give a cure of a disease by some home remedies. But that's not how the medical science works. There are various things like there are precautions, there are cures, and then finally homeopathy, allopathy, aapka Ayurveda. So how would you like to differentiate between all of them and put them in a proper sequence for a general person?
When you talk about health, I strongly feel this and I strongly abide by this. And my father, Dr. Bakshhi, and I are very, very close to this particular notion that no science is complete, Aftab. No science is complete. Homeopathy is not complete. Allopathy is not complete. Ayurveda is not complete. Unani and yoga are by itself not complete sciences. कोई भी science अपने में complete क्यों नहीं है? अगर वो complete होती तो दुनिया में एक ही science चलती ना. But क्यों आज इंडिया में ये सारी sciences चल रही हैं? Because together we are all complete. This is why the government has introduced a system called the AYUSH body of medicine, which is nothing but all our allied sciences together. Ayurveda, Yoga, Unani, Siddha and Homeopathy. AYUSH stands for this. So this is what it teaches you. Homeopathy की अपनी जगह है. Allopathy की अपनी जगह है. Allopathy works great in acute emergencies. In a heart attack, you will not think of Ayurveda or homeopathy, right? But homeopathy works great in chronic illnesses, great in illnesses in acute conditions where you know that you don't want to take allopathy, right? With injuries, with skin conditions that are sudden and acute, urticaria, gluten allergies, homeopathy has great relief. And Ayurveda itself is a lifestyle. Ayurveda is not just a science. So सब sciences अपने में unique है. हम इन सबको जब combine करते हैं ना और जो वो हम lifestyle जीते हैं उसको हम बोल सकते हैं वो एक complete lifestyle है. कोई भी science अपने में complete नहीं है.
But still I feel there is a lot of, I would say, myths going around things that people usually don't go with it. As in, like if somebody says homeopathy to me,
right,
I would feel home remedies, ghar ke nuske, ghar ke ilaj and all that stuff.
Yeah.
So I would think about that. So what do you feel about those things when you hear such things?
Aftab, I'll tell you a story. You'll be shocked. I was at a very big conference this year, okay? I think in April, a very big conference. And I was in a conference in a foreign country. And I was in a taxi, right? And this taxi driver asks me, what do you do, madam? I said, I'm a doctor. He said, what doctor are you? What do you practice? I said, I'm a homeopathy doctor from India. He's like, what homeopathy doctor? Home remedies, so even I do at home. So he understood homeopathy as home remedies, which was the biggest joke of the millennium. And I think I'm going to quote this in every conference I go to. Because don't mix homeopathy with home remedies. home remedies have come from our lifestyle, have come from our predecessors, our parents, our grandparents. You know, हल्दी चंदन लगा लो अगर टैन हो गया, हल्दी किसी चोट पे लगा लो, एंटी इन्फ्लेमेटरी होती है. इनकी अपनी जगह है. अपनी जगह क्यों है? बिकॉज नॉट एवरीबडी, आफ्ताब, our entire country, not everybody can afford good health care. Homeopathy also is has not reached every citizen in our country. I will still say that. You know, nor has proper healthcare. So my goal has also been to make sure first that homeopathy and home remedies are two separate things. Homeopathy remedies are completely different, and I think many people associate it with meethi golis. Meethi goli dedi, you know, that's homeopathy.
Yeah.
And because that's all we know, right?
Yeah.
So when you talk about home remedies, they've come from our predecessors, our ancestors, our grandparents, parents, right? हल्दी लगा लो अगर चोट लग गई, हल्दी चंदन का फेस पैक कर लो अगर टैन हो गया, आंवला खा लो क्योंकि यू नो इम्यूनिटी कम है, रोज सुबह आलमंड्स भिगो के देना. इसकी अपनी जगह है, इम्पोर्टेंस है, बिकॉज इतने सालों से उन लोगों ने ये रेमेडीज टेस्ट करी हैं. क्यों आलमंड्स भिगोए जाते हैं, रॉ क्यों नहीं बोलता कोई खाने के लिए? ताकि उनकी पित्त जो हीट होती है वो कम हो जाए, राइट? एंड बिकॉज आलमंड इज कोटेड विद a small layer, if you see that brown layer, right? आलमंड के ऊपर एक ब्राउन लेयर होती है, that's difficult to digest. So उनको कैसे पता था इतने साल पहले ये होता है? नहीं पता था ना. But then they started these practices that helped them, है ना? क्यों हम दही को जमाते हैं, कैसे जमाते हैं, किसी ने सोचा होगा ना कैसे जमाते हैं, और वो कितना अच्छा होता है गट के लिए. क्यों? क्योंकि उसमें इतने ज़्यादा माइक्रो ऑर्गेनिजम्स होते हैं, गुड बैक्टीरियाज होते हैं जो हमें हेल्प करते हैं गट रिजुविनेशन में. सो होम रेमेडीज़ की अपनी बहुत अच्छी जगह है, स्पेशली इंडिया में. यू नो, आई जेन्युइनली फील वी आर वेरी लकी एज इंडियंस टू बी इन भारत. हमारा भारत एक ऐसा देश है जहाँ पे ईयर्स एंड ईयर्स एंड ईयर्स ऑफ रिसर्च हमें घरों से आती है, ये बाहर से नहीं आती. एंड जब हम होम्योपैथी की बात करते हैं, उसकी कम्प्लीटली अलग वर्ल्ड है. होम्योपैथी और होम रेमेडीज में ज़मीन आसमान का फ़र्क है. होम्योपैथी वर्क्स ऑन द प्रिंसिपल्स दैट लाइक क्योर्स लाइक, विच मीन्स लॉ ऑफ सिमिलिया. कि अगर मैं किसी को पेशेंट को प्रिस्क्रिप्शन देती हूँ एंड द पेशेंट इज़ एग्जिबिटिंग सिम्टम्स लाइक चेंज ऑफ मूड, डिलेड मेंसेस और कॉन्स्टेंट एंजाइटी, कॉन्स्टेंटली टीयरफुल है पेशेंट और वो फीमेल है, आई विल इंस्टेंटली थिंक ऑफ अ रेमेडी लाइक पल्सेटिला विच इज़ देयर इन होम्योपैथी, जो एक फ्लावर से बनी है, राइट? सो एक कम्प्लीटली डिफरेंट साइंस है और बहुत इंटरेस्टिंग साइंस है, यू नो.
That allopathy is more based on this individualistic treatment in comparison to the standard treatment with homeopathy is based on this individualistic idea of treating someone, a patient, in comparison to when you go to allopathy and stuff, there is a standard treatment. If you have this disease, you will be treated by this medicine. So what do you feel about this difference?
Definitely, Aftab, it's so huge. In homeopathy, there is a phrase, one man's meat is another man's poison. Law of individuality हमारे cardinal principles में आता है और हमें पढ़ाया जाता है law of individuality. ये क्या होता है? हम जब पढ़ रहे थे ना in college and med school, हमें बताया जाता था कि what is law of individuality? How can you see it in your patients? Every patient is different. Every two individuals are different. There is no way you can think कि एक पर्सन की जो डिजीज़ है जिसके लिए आपने मेडिसिन दी है होम्योपैथी में, वो दूसरे इंसान को भी वही मेडिसिन दे दो उसी डिजीज़ के लिए. दैट्स नॉट पॉसिबल. दैट्स नॉट पॉसिबल बिकॉज ऑफ द फैक्ट दैट एवरी सिंगल human is made differently. However, here I'd like to add one fact. When you talk about modernization, can I prescribe for you, for your friends, for your family, all in an instant, in an acute condition, in priority of individualization? मैं आप सबको एक ही दिन में ठीक कर सकती हूँ? मैं इतनी अपॉइंटमेंट्स ले सकती हूँ एक दिन में? मैं नहीं कर सकती ना. शायद इंडिया के डॉक्टर्स भी नहीं ले सकते. Which is why individuality is being questioned, right? So in homeopathy, every case is unique. मैं हर केस में symptoms मांगती हूँ. पहले मैं symptom study करूँगी, फिर medicine prescribe की जाएगी. But here, when I went on to that phrase and I told you that I cannot, as a doctor, I cannot treat 500 patients a day, which is where over-the-counter medicines help for sudden diseases. Do you get it? Like homeopathy में I can individualize for you, right? I can individualize for 5 more people, 20, 40, 100 people in a day. उसके ऊपर तो नहीं कर सकती ना. But अगर साइंस को बढ़ना है, तो साइंस डॉक्टर्स, एंड आई एम अ डॉक्टर, मेरे ऊपर बढ़ेगी. साइंस को बढ़ना है तो वो एक डॉक्टर साइंस रह के नहीं जी सकती इस कंट्री में. which is why over-the-counter medicines of homeopathy medicines are really effective. They're really effective. You can just go over the counter, study what medicine you need, and you can get it. You know, so that really helps.
Yeah, and also now moving towards the more of this section that is now very active on social media, that is skin. As in skin, aapka hair, these are some things which are now people very insecure about. And creators are making money out of it. Brands are promoting themselves and all that stuff. But when it comes to things like this, homeopathy is also used a lot.
Yeah.
But we genuinely don't know who is correct and who is wrong, and who is genuinely willing to give a treatment that is going to make a change. So there is this a lot of, sometimes I would say, hoax about certain treatments related to skin or hair when it comes to homeopathy. As in your personal expertise with it, the homeopathy thing, what do you feel about that?
First of all, when you talk about hair and skin, it is one of the biggest markets because it's one of the biggest problems, right? And because it's a problem, as you said, people are making money out of it, right? So when people are making money out of it, I don't say that it's a wrong thing that if they're making money out of it, they're also helping people. I will always say that. You know, anybody today, if they're putting their time and energy on social media and explaining something, I feel that they're doing justice to what they know. You know, जितना उनको पता है वो उतनी knowledge दे रहे हैं. Like it's very easy for you and me. I'll be honest with you, it's easy. And ये हर इंसान करता है. I've done it. It's very easy for you and I to come and say, I see 40 things on social media, which one to believe, right? But understand all of this is coming from knowledge. And because we're overstimulated on social media, we're getting over amount of knowledge. When we get too much of knowledge, we end up being confused. That is what is happening. मैं कभी नहीं बोलती कि कोई गलत बोल रहा है, बिकॉज उसके हिसाब से उसे उतना ही पता है ना, और वो अपने हिसाब से तो बिल्कुल सही है. अगर मुझे ABC के आगे D नहीं पता होएगा या E नहीं पता होएगा, F नहीं पता होएगा कि क्या है, तो आप तो बोलोगे ना ये तो पूरी गलत है, इनको तो C के आगे काम स्पेलिंग ही नहीं आती है ना. So I personally choose to believe everybody is doing their best on social media, their best from what they know, you know. And when it comes to homeopathy and doing skin and hair, my single advice is go with people who have done their research and who can claim and say that it has helped them. So with me in particular, as a doctor, as a practitioner, as a researcher, every medicine that I today put up on social media and say I use this, I've used it for years. Years and years and years I've used it for. So supposedly your hair reviver mist, right? I've used it for months. आज एक साल हो गया है. Yeah.
Producing?
So your Bakson, yeah, exactly. The Bakson's hair reviver mist, I've been using it for more than a year. Last September it launched. I started with that product for nobody. I didn't want to bring it out in the market. I started it for myself because I had less hair here and I wanted more hair. And I started applying it and I got more hair. And I was like you can see my hair volume also. And I realized as a normal girl, if it works on me, you know, it can work on anybody. And my dad said, give it to more people because they will get better health and hair from it. You know, that's when we decided, okay, let's try giving it to people.
What sort of ingredients and research is involved when it comes to products which Bakson is producing?
So we have a very, very, very strict quality mechanism. So when you talk about Bakson's quality, it really, really matters to us. Like herbs come from all across the globe in our factory. They will be accepted or rejected just on basis of their quality. No matter if that herb comes from Mexico or USA. If it's not good quality, it will be rejected. Number one. Then your lab parameters matter. Your TLC, thin layer chromatography test. Your mother tinctures have several tests through pharmacopoeia. You need to get them done. Again, every single medicine of yours, Dr. Bakshhi at Bakson, goes to such an extent where I've never seen this ever before. He practices and uses that medicine on himself. So like I used the hair reviver on myself, my father used medicines like Avena sativa for cholesterol. You know, there's a stone clear remedy. We used it on ourselves to understand if it's really, really working on close friends and family who wanted to try it. No? So he works on the regime where our entire family wants to try stuff on ourselves before we say, yes, use it. Look at the amount of trust that another person can have in you. तुमने use करते हो, तुम use करते हो. My friends use it just on the basis, यार तानिया लगा रही है, सही है. That's the kind of faith you bring when you do it on your own self, when you try it on your own self, how many people do it? Very few people do it. Because you can't claim, right? You can't say you use your own skincare or you use your own hair care, which is where your questions answer comes in. What to believe on the internet or what not to believe on the internet? Believe people who use their products on themselves. That's the simple logic, na? उससे better logic हो ही नहीं सकता.
But also, apart from applying the products, yes, it would be good. That's why it's giving results. But there would also have been some other lifestyle changes that you would have done.
Tremendous.
Yeah? Would you like to elaborate on that for the audience?
So, not me. I only did that because the rest of my lifestyle was good enough. Like I was exercising, everything else was good. You know, I always have led a very healthy lifestyle. When it came to nutritional part of leading a healthy lifestyle, I noticed that by not having the right food, good homemade food, your tori, your tinda, your bhindi,
You do have that?
I still have that. I have home food all throughout. मेरे घर में बाहर से पिज्ज़ा नहीं आता. हमारे घर में बाहर से पिज्ज़ा तब आता है जब किसी को कोई आया होता है guest and they want it. Every night, because we're a doctor family, you know, we realize and we see the importance of health. As doctors, what do we eat at home? Tori, tinda, ghia. It's the basic. आप जाओ सब्जी मंडी जाओ, right? What are you going to see? You're going to see this. You're going to see seasonal vegetables, right? And that's why we buy our produce from. So I made it a habit, Aftab. Now we go there every 2-3 times a week. I go to the sabzi mandi, see what's in season, get it, tell bhaiya, let's cook this. Why are we not cooking this? Even if you want to make Chinese, why are you not cooking at home? Why not? The art of cooking at home can transform your health. Forget about your hair, your entire health. Not just you, anybody, I mean. The art of just eating homemade meals is massive. There is a reason years and years before our parents and grandparents have sustained on this. It's not just commercially viable, you're also helping the farmers. Then you're helping your own health. So the last time we ordered a pizza or a burger was probably 4-5 months back. That too because somebody came and they wanted it. Like, you know, we really, as Indians, should embody the culture that home cooking, everybody should know.
And also, like, being a vegetarian, do you feel you have a upper hand on this thing? Or even non-vegetarians can also sustain with healthy diets?
Aftab, I was a non-vegetarian for the last 24 years of my life.
Okay.
I only changed into a vegetarian in the last year. And that too, it was a transition that took 2 years for it to completely say I am a vegetarian, you know. And I've quit everything from chicken to meat and everything. And when you talk about transitioning from a non-vegetarian to vegetarian, or when you say, does it help with your cooking? I genuinely feel when you cook yourself, even for 10 minutes or 20 minutes, and it doesn't take time to steam vegetables, to boil them, to put them in the oven, to even do them in a normal pan, doesn't take more than 15 minutes. Doesn't take it. It has improved my mental health. I know what I'm putting in my food. I know I'm taking out time to care for my body and my mind. And, you know, taking out time to do that is self-care for people. Consider that as an activity for your own health. Then I'm also making it very commercially viable, right? Because I'm not overspending money on eating outdoors. Fifth, I am also making sure that I'm eating local, organic and seasonal. Really matters. आपकी food knowledge कितनी बढ़ जाती है? That is why you've seen every food blogger, every chef will love what they do. Will love what they do. Have you seen a chef become angry? मैंने बहुत कम देखा है कि angry मतलब that they'll become angry at the fact that they're not getting right food and they can't cook food, or a cook saying I can't do this. I have seen cooks and chefs accommodate, be helpful, also at the same point in time do every single thing with a smile on their face. Because they love what they do. Anybody who associates themselves with cooking for them, their own health, really impacts their own mental health. Really does it. I've never seen a chef who has ever told me that, listen, I'm eating too much unhealthy food. They know what they're eating, yeah. A cook or a chef will know what they're putting in their food or your food, you know. So think like that. It definitely helps.
Also, I guess you must have encountered some patients at your own faculty where, you know, some people are consuming liquor, and especially some of them are having some really serious skin problems or hair issues. Do you feel like liquor also has a big role to play in it?
Aftab, you've hit the nail in the coffin with this question. Nail in the coffin. In my medical practice, the first thing I say is if there's any skin issue, psoriasis, eczema, dryness, itching, first thing you need to stop is stop taking any form of alcohol. Stop it. Stop it right now.
Even in a little quantity.
I say if you're taking a lot, go once a week, then you completely stop it. Taper it off. अगर मैं किसी को बोल दूंगी जो रोज alcohol ले रहा है to not take alcohol, he's probably going to go out and he's going to say thank you ma'am, I don't want to do this anymore. Right? So you taper it off in patients. Reason I'll tell you. Alcohol is a very big inflammatory agent. Alcohol when taken, have you ever felt good after taking alcohol in the morning? Like suppose you take alcohol at night, and have you ever felt good? No. We all have hangovers, right?
Yeah.
People have hangovers because they take alcohol. Their body pain, soreness, dizziness, fatigue, mental health is completely ruined the next morning. You know, you don't want to go to the college, you don't want to work, you're just irritated in general, right? If you have arthritis in the family, don't take alcohol. Reason is, it'll cause inflammation in your joints. Your liver, massively impacted. Massively impacted. I've seen 50-60-year-olds have itni si alcohol le lenge 30 ml every day. You know what the condition of the liver is? Because that itni si alcohol is not just one factor, right? It's having that alcohol in the evening when you should not be having anything post 7:30. 7:30 should be your last meal. But you're having alcohol, then you'll have dinner at 8:30, then you'll have dessert. By the morning when you wake up, you won't have the energy to go outside or exercise, right? Because you're waking up with a hangover, right? So what do? Taking alcohol might not be a good choice for your lifestyle. It's not just now, it's a lifestyle choice.
Not only related to skin,
not
but
just
other issues
skin
also.
products, skin issues or hair issues. Hair issues also I say is taper off smoking and drinking. Smoking I'm very against with all my patients. Everybody. The reason is if you see a label, right, which says that this causes this and you're still having it, you know, what kind of impact does that have on your body? I've seen 60-year-olds give up smoking at the age of, let's just say, 62, 63, 64, 65. And by that time, you've ruined all your health. You've ruined all your health in those 60 years of, or at least 30 years of your life where you've taken constant stimulants like smoking or drinking, you know. So it massively impacts your health.
If you could just elaborate a bit, as in this is something that people just know it's bad. Like what smoking basically does to your body?
Okay. Have you read the label? What does it have? Why do people smoke? What does it have?
Nicotine?
What does nicotine do?
It makes you, I guess, feel good or something.
Right. But it also makes you an addict. So you will want to feel good with that nicotine again and again and again. Soon it'll be 1 cigarette, then it'll be 2, then it'll be 3. Suppose you have stress in the family, it'll probably be 5. By the end of the day, you've taken 5 cigarettes in a day. Right? And you won't realize it because you're like, yeah, it's giving me a lot of like calmness. Yeah, it's giving me a lot of like no stress. Now I just have no stress. I can just work. No. But that's not the way to deal with stress. You can't deal with stress negatively by taking a stimulant. Right? And that's not good in the long term. So what smoking does in your body is you take nicotine, you also take some very harmful agents for your lungs. That's why smoker's cough is a term. In medical terms, smoker's cough is a very big term that people see with patients. After smoking, you would develop a cough, which is smoker's cough. वो cough जाता नहीं है क्यों? क्योंकि lungs को damage हो रहा है ना. अगर lungs को damage नहीं होता, वो cough चले जाता ना. So the first thing you need to see is that how is smoking impacting your health? And smoking is not just, oh, I feel good now, I'll do it once. You're taking something that's going to make you an addict.
And the younger start, I guess it's worse.
It's worse. It's horrible. It's horrible. Also, such a negative way to deal with stress. And unfortunately, the millennial generation, the Gen Z generation doesn't see this right now. But imagine 20 years down the line when these, when vapes and all these things have become so common now. And I will openly say they're the worst for your health. You're doing this because of a certain reason, right? Because you want to relieve stress. You want to look a certain way. You want to feel a certain way. I asked teenagers in my clinic, why are you doing this? What is it bringing you? He said, I just feel like I can be a part of a group. I can be a part of a clique if I do this. If I have a vape in my bag, I look a certain way. I feel more confident. I can't believe a 15-year-old child is telling me that by having a certain vape, I'm feeling confident. Because, I feel like I'll just look better, I'll just feel better. Why can't it be the same way for good health? For practices that really, really help. Going out in the morning, indulging in sport, indulging in exercise, doing something positive for your health. Go cook that meal that you like. Go make it. See, it takes effort. It takes patience. It'll test you. That's why I told you, all your chefs are tested continuously. Patience it takes to cut vegetables, And whenever you cut vegetables, don't think you're just cooking. You're also testing and rewiring your neurons because you've not done that. Any new thing you do, you're rewiring your neurons. You're creating new neurological pathways. And every new thing you do, take that as a blessing. Your brain is learning something new. New pathways are being created. Really important, Aftab.
And also talking about the Gen Z, since you mentioned the 15-year-old case, one thing that is very common nowadays is hair fall in young people. Like earlier it used to be case when people used to reach a certain age and they used to get it, but now people who are very young, barely even 19 or 20 years old, they are having it. So what's the whole sole reason behind such things?
Aftab, I discussed this same thing in a reel I currently posted. Same thing. And my logic says the more patients I take of a certain age, our generation is aging faster. You and I sitting here are aging faster than our grandparents and our parents. What happens when you age faster? What happens when I say I'm aging faster than my grandparents? It means that my health is affected. The number of cells in my body that are working to give me good health are already a certain age. So your body age is different and your birthday age is different. In certain areas of your life, you are not giving your body the attention that it needs. So I'll tell you what's happening with our generation. We live in highly polluted environments, highly polluted. We all want to be city people, no? Nobody wants to go to the village. If I tell any young person go to the village and live, they'll be like, are you mad? They don't even have internet. What will I do without Instagram, right? And rightfully so. Our generation is different, So we live in very polluted environments. We also have food that is very, very commercially made. So even the raw food that you take usually nowadays is very, very commercially made. Anything that's commercially made for billions of people will not be the best, right? Third factor. Our food is contaminated. Our air is contaminated. Our water is contaminated. Even the water that you shower with, check that water. That water can cause hair loss. Water-related hair loss I also talk about on Instagram. So because of our environment, we're aging faster. Then the bomb thing that's majorly affecting our health and we're aging 20 times faster, I feel, is stress. Our desires have increased. This generation, we want to do so much. We want to be great children. We want to be millionaires. We want to be billionaires. We want, at a certain age, not billionaires at 50. We want to be billionaires now at 25, 26. We want to struggle all night. We want to work hard. We want to do this. But that generation is, and we want to compete with other people on Instagram. Let's not forget that. We're very good at that,
Yep.
So what's happening? We're constantly stressed to do more, to be more, to achieve more, to have more. We're never contented and grateful for what we have. No, but this is one generation, I'll say, which has received everything. Our generation is so lucky that we've received everything, but we're the most ungrateful generation. And that is why I purposely say these terms, we're ungrateful, because we don't realize we have everything. But in the realm or in the urge of getting what we don't have, that we want to be a billionaire, we want to be influencer, we want to be creator, we want to have 5 businesses, 7 businesses, money, relationship we want fantastic, kids we want, before a certain age, we're ruining our health. How stressed are we when we're not sleeping till 1 a.m. in the night or 2 a.m. at night, and children our age or even youth our age, they're all having issues where sleep is a concern. People are now having sleep issues. Young students, young children.
People are taking sleeping pills.
Yeah,
actually.
they're insomnia.
Mm-hmm.
So I will say stress is a very big factor after. When we're aging, what happens? जिसको 50 years में genetically hair loss होना था, उसको 30 में शुरू हो जाता है. Body तो stress ले रही है ना, वो तो inflammation mode पे चल रही है. हो गया. And all your genetic factors that are there in your body, you have received from your grandparents and parents and relatives, blood relatives. They will all become active only at the time of your weak immunity. कभी देखा है दर्द, जोड़ों के दर्द एंड में क्यों आते हैं, एंड ऑफ लाइफ कभी देखा है? 70-80 में होते हैं ना जोड़ों के दर्द, 60 से 50 प्लस में होते हैं, उसके बाद जोड़ों के दर्द शुरू हो जाते हैं, बट अब तो पहले से हो रहे हैं. नाउ तो 10-year-olds have migraine, right? So you have to understand our generation is aging faster, plus the use of media. 2-year-olds, 3-year-olds know how to dial phones and call. They know which song to put on Spotify. You know, they know what to tell Google. You know, so I feel like our generation's so overstimulated that we're stressed and we're aging faster. And genetics matter so much. But genetics earlier in life for your grandparents and parents used to be controlled, right? Because of their lifestyle. So a healthy lifestyle, calmer lifestyle, more time for themselves, limited hours of work, no? All these things were there earlier. Jo ab nahi hai. You can control your genetic influences with your lifestyle. But this lifestyle that the young generation is leading is not going to control even the genetic influences in time. So think about the fact that your new generation is going to lose hair quickly. It's going to fall sick. It's going to have skin diseases. It's never had. जो बाद में life में होनी थी, you know, they're going to have that because they're constantly stressed. I've never. Aftab, tell me, have you seen one of your friends say that यार छोड़ ना, career छोड़, सब छोड़, मेरे लिए तो ये moment matter करता है. I want to live for today. Really? कौन देखेगा? वो जिसको जो बोल भी रहा होगा, आप बोलोगे ये तो पागल है. Why will I give him energy? He's saying nonsense stuff, right? But understand that we're all overstimulated. You and I both. We're all overstimulated. Our lifestyle is like that. And we as a new generation are going to be people who might be impacting our future generation, our kids, how they are being brought up, how they associate their body with, their filters, their skin, everything, everything.
As a doctor, how do you see it, the future perspective of kids? If you like to elaborate it a bit.
I'll just tell you one thing, Aftab. If I can say one thing, I've chosen that for my kids, I'll move into a very small hill station and I'll choose to live there. I think that'll give you a good answer why. Yeah.
Metro city.
I can just speak about myself and I'd choose that. No, not just in a metro city. Metro city is not a problem. But it's the way our children are being brought up that's a problem. If my child is great at mathematics and not great at music, and I'm still saying music class, jao, music class karo, and also if my child is not great at math, right, and if he's good at creativity, how many of our kids are given the importance of music, art, culture, dance, physical education? No. We're running towards STEM thinking that this entrance will give us a great life. It is the passion and dedication that equals success. That is it. If you have passion and if you have dedication about what you're on about and what you're doing, you can get successful. And I strongly believe our future generation, the future kids, our kids, your kids, everybody, they might be impacted by our choices now. And if we don't act in time and we don't change how we are and how we think about our relationships and our life, they'll be impacted, and very negatively. I've seen mothers do makeup in the morning, right? And I've seen their daughters look up to their mother. And the mother says a certain thing about herself on the mirror and she says, I look too dark right now. I look too dark. The child picks that up. And the child uses that analogy on himself or herself. But I'm too dark, mama. I'm too dark. I've seen that in my clinic. Your children are watching you. Your children are watching you do things even when you don't do things. Even when you're typing on your phone, your children are watching you. They're watching every single habit, and that's where your habits come from. So if you have a good child who's really calm and who's really just doing reading and writing, see their parents. सच बोलना और झूठ बोलना भी माँ बाप से आता है. You will always see that. गंदे इंसान जो होते हैं ना, उनके बच्चे कभी भी अच्छा लाइफ में जब करना चाहते हैं ना, या जब कुछ करना चाहते हैं, there's always a genetic influence. So make sure you can change that now. There's always a genetic influence, pushing them back. Because वो किस environment में grow up हुए हैं, उनके genetics क्या कहते हैं, ये सब चीज़ें matter करती हैं. तो ये बहुत matter करता है.
Moving back to homeopathy again, perhaps we need a separate podcast to
Yeah.
discuss society.
Yeah.
About homeopathy, there is this thing that goes on social media and shown in some researches also, that one cannot trust homeopathy when it comes to some serious chronic diseases which are going to stay for longer period of time. Might be cancer, might be an heart attack. So what do you feel about that?
First, about heart attack, it is not chronic, it's acute. It's not chronic, it's acute. In heart attacks, in cases of heart attacks, you can see artery blockages for years and years. Your arteries get blocked because of cholesterol buildup. Okay? So जब हम बोलते हैं ना इसकी तो 95% arteries blocked है, सारी arteries blocked है, जो हम common terms नहीं use करते medical analogy में, इसका मतलब ही ये होता है that years of abusive lifestyle have led to a heart attack. Okay, simple logic, simple and very simple logic in case of a heart attack. Homeopathy can only help with giving you the right kind of lifestyle. I told you, my father, knowing that he is 72 right now, okay, he takes his Avena sativa in homeopathy for cholesterol. He takes his cholesterol medicines, allopathy also and homeopathy also, to avoid, God forbid, to get at that stage of a heart attack. Right? You prevent with homeopathy. You use all these things in your lifestyle. You know, you take the right medications and you take the right nutrition, and your lifestyle changes. He exercises every morning. Exercises more than me. Bench presses. Right? Bench presses, yoga every morning. You should see him. Come meet him. He's 6 feet 4 inches. He's known as the god of homeopathy, Dr. Bakshhi, and for a reason. And I'm telling you, that is how we all should live our life. He eats soup and salad in the evening. Soup and salad, that's it. There's no roti, and we are a Punjabi household. I'm a Sikh. There's no butter chicken. There's no dal makhni at night. There's no chole at night. Nothing.
Just salad.
Soup, salad. And ghar ka salad. Ghee ka soup suna hai? We drink that. And it's one of the most nurturing things you can do for your body. Just that. It makes a massive difference. Take normal vegetables, cut them up, make a vegetable broth out of it, and have soup at night. You're going to see a massive difference in your body.
What about missing out on the fun part?
No. I think the fun part exists, but have it in the first part of your day. So my dad does have his roti, his rice, his palak paneer, his matar paneer, his dal makhni in the first part of your day, which is the break that you get at 12:1. Why? Because the digestion is at its peak at that hour. You should have lighter meals at the end of your day and heavier meals in the first half of your day. Now, when you said about homeopathy and chronic conditions, homeopathy only, majority of us in homeopathy treat chronic conditions like psoriasis. There's no cure. You can get creams, eczema, bronchitis, asthma in children. We only have majority patients for chronic conditions. However, when you also talk about cancer, there are some homeopaths who actually have termed and treated cancer with allopathy in the partnership. So with allopathy, you're getting chemo, radiation, right? And with homeopathy, you're also taking your medicine for cancer. So it really matters. मेरे पास एक medicine है X-ray 30 in homeopathy. वो बनी किस लिए, अगर आप उसके देखोगे कि हम पढ़ोगे ये मटीरिया मेडिका में, किस लिए है? To relieve the symptoms of acute रेज का स्ट्रेस जो हम कीमो में देते हैं. तो X-ray 30 इज़ अ गुड मेडिसिन टू गिव टू दोज पेशेंट्स जिनको कीमो हो रहा है, राइट? क्योंकि वो सिम्टम्स मैच करते हैं उसमें. So that.
So, but solely this thing cannot work, homeopathy. It has to collaborate with another medical field, right?
Not in every case, no. In cancer only.
In cancer only.
In cancer only, but in BP cholesterol, if I tell anybody to stop have BP cholesterol, thyroid, if I tell them immediately stop your medicine of BP and cholesterol, I will be the most irresponsible doctor in the world if I do that. Why? They're taking that for how many years? 10 years. If I take that dose off, what is the body going to do? Body is going to throw off symptoms. Immediately that BP is going to shoot up. Immediately. When you talk about cancer, only then, I told you not, sciences combined need help. In chronic conditions like psoriasis, eczema, homeopathy alone can work. I have seen acute conditions of diarrhea where only homeopathy can work. Headache, only homeopathy can work. Pregnancy, scare, delivery, homeopathy works very well. In pregnancy, you shouldn't take allopathy. So you take homeopathy. It works very well. Gastritis, gastric burns, very, very well.
Also, there's also this another theory that's on internet. It's about the placebo effect related to homeopathy. Like it's all about the placebo effect.
ये
you
तो gold
feel.
question है भैया, जल्दी पूछो इसको तो.
So, like you know what I'm going to ask. So, what's about the deal with placebo effect and homeopathy?
जब हम किसी को प्रूव नहीं कर सकते और हम जब उसमें डिड्यूस नहीं कर सकते कि इसमें इतना मात्रा में ये मेडिसिन है या ये एफिकेसी है, तब हम बोल देते हैं वो प्लेसिबो है. जिन रिसर्चर्स ने अनफॉर्चुनेटली या फॉर्चुनेटली ये रिसर्च करी, वो कितने पुराने थे ये पता है? नहीं. ये शायद 10 साल पुराने थे, 5 साल पुराने थे, 2 साल पुराने थे. My research says with the way our current research team in homeopathy in the country and beyond is working, we today have tested homeopathy medicines in nanomillimeter scale. एक पानी में हमने homeopathy medicines डाल के देखी, and some very good doctors have done this research, and I've been in that research facility and I've seen them do it. Because when they put that homeopathy medicine in the water and they get that water they test that water under a microscope, you can see that there are crystals formed of that medicine. हर medicine अलग है. हर medicine को हमने टेस्ट किया, सब में अलग अलग crystals थे. पल्सटीला में अलग, ब्रायोनिया में अलग. तो ये तो मतलब है ना कि इसकी तो प्लेसिबो नहीं हो सकती. मैं तो खुद बोलती हूँ, जो बोलता है ना होम्योपैथी प्लेसिबो है, एक होम्योपैथी मेडिसिन लो, फटाफट गटक लो. क्या होएगा? रिएक्शन होएगा. इट्स अ होम्योपैथी मेडिसिन. You cannot take it like that, and you can't say lightly that it is a placebo. It is a highly qualitatively made medicine. When you talk about homeopathy, don't talk about, or not you, just generally, don't associate it with placebo ever. Because you don't understand, when you say it's placebo, you're telling people, अच्छा इसमें तो कुछ नहीं है, इसमें बहुत कुछ है, इसमें herbs हैं जो डली हैं, जो एक limited quantity में और quality में use होनी चाहिए. वो ज़्यादा यूज़ हो जाए तो प्रॉब्लम हो सकती है. अगर मैं आपको किसी ड्रग पे डाल दूँ 2-2 साल के लिए, आपको रिएक्शन शुरू हो जाएंगे. एलोपैथी हो, होम्योपैथी हो, आयुर्वेदा हो. टर्मरिक ज़्यादा खाने में डलने से, मिर्ची ज़्यादा खाने में डलने से मॉर्निंग रिएक्शंस क्या होता है? स्टूल में बर्निंग होती है, राइट? चिली अगर हम ज़्यादा खा लेते हैं, ज़्यादा टर्मरिक खा लेते हैं, हीट प्रोड्यूस हो जाती है बॉडी में.
एंड आई गेस एक रीज़न इसका पीछे ये भी हो सकता है बिकॉज यूजुअली पीपल स्टार्ट शिफ्टिंग टू होम्योपैथी व्हेन दे आर डन विद देयर ट्रीटमेंट. कि ना अब कुछ कर लिया हमने सर्जरी या वी वर ऑन हैवी मेडिसिन्स, तो अब जब हो गया कि यार छोटा मोटा पेन है अभी, तो लेट्स मूव टू होम्योपैथी. सो आई गेस दैट इज ऑल्सो वन रीजन बिकॉज दिस प्लेसिबो इफेक्ट एग्जिस्ट.
ऑल्सो I'll answer that question. When it comes about placebo, another thing is, when we make any medicine, see the ingredients of it. Now you know if it's placebo or not. See the back label of any homeopathy medicine. You'll see immediately if it's placebo or not. How is this science sustaining for more than 40 years if it's placebo? If I'm just giving you nothing and no medicine, I'm just giving you placebo, how are you getting better? How is homeopathy working in the country for the past so many years? And at Bakson, we're able to run facilities and make sure that homeopathy reaches millions and say our medicines are working if it's placebo. The problem is people are not learned enough. They have not learnt about a science. मैं बोल देती हूँ, oh, this kind of diet is very good. You must do it for your weight loss, Aftab. By what? By seeing one pictograph, one research paper. Not realizing Aftab needs full medical health care. Right? So whenever you believe any fact on the internet, understand and see how it's practiced in real life. And then you'll know. मंदिरों में अगर जाते हो ना, कोई भी मंदिर जाएंगे, कोई भी अगर जाता है मंदिर, या अगर आप कहीं पे भी जाते हो लोकल कम्युनिटीज़ में, गुरुद्वारे में, होम्योपैथी मेडिसिन्स दी जाती हैं बाय डॉक्टर्स एंड प्रैक्टिशनर्स. क्यों दी जाती हैं? वो तो प्लेसिबो है, भगवान का नाम लेके देते हैं वो? नहीं, वो सब में मेडिसिन होती है. एंड आई विल इवन से होम्योपैथी इज़ हेल्पिंग इन रिलीजियस प्लेसेस लाइक गुरुद्वारा, इन मंदिर्स. वाई? Because it's helping people. It is the most affordable form of treatment. Today, my certain kind of medicines or drugs in any kind of medical world might not be affordable. You know, and homeopathy is very affordable. People run it in charity clinics, in gurdwaras and in mandirs. Why would they do it? They do it because it's efficacious. People are getting results. You know, and I really urge anybody who says it's placebo, come to Bakson's Homeopathy Medical Center. Come, meet us and see our results. Come and see what we're doing and you'll be shocked. Just yesterday I had One patient called me all the way from Assam. I'm cured. I'm bringing my sister also. She also has this condition. I said, you have not met me in a month. You have taken your medicine for 2 months. You have not met me in a month. First, you meet me and see. Let's see how your case progresses. He's like, I'm fine. My acidity is gone. I'm completely okay. How am I treating this case of severe acidity for the last 20 years with placebo? No, yeah. It's not possible.
Mm-hmm.
Again, our research was probably not complete at that point in time and is now. Also, homeopathy एक मात्रा के ऊपर measure नहीं हो सकती थी पहले, जो अब हो सकती है. You know, nano millimeters में हम जा सकते हैं. With highly researched stuff. It can go.
And also, when I see the flow of this conversation, this whole podcast, I see that you always say that there is the combination of everything, allopathy and homeopathy. Lifestyle is a very certain thing, but in terms of technicality, it's a whole fusion that you brings to the table. So when it comes to the Bakson's lab and everything that you do there, what do you feel the fusion is about, and what is that one thing that people should know about this fusion?
This fusion of leading everything together, like don't be, so everybody should know, don't be irrational with your health. Don't say one diet will only cure my health. One particular diet is only what I want to eat. I want to eat this particular medicine every day for the next 2 years of my life. Don't be adamant and irrational with your health. Don't say I'm going to leave a medicine of thyroid and use some Ayurveda or homeopathy medicine immediately. You're going to jeopardize your body. Don't say this is one superfood you're taking in nutrition value. You're taking one superfood. Rose, you're taking that superfood in large quantities. No, it's a superfood for a reason. You're supposed to take what? Itna sa, and you're taking itna zyada. You know, don't be irrational with your health. Don't do that. One advice for everybody. That's why go to medical professionals. You know, when you talk about every science working together, let that science work together. At Bakson's multi-speciality hospital today, we have a great allopathy facility. But when people in that allopathy facility cannot get relief, we also have a homeopathy facility, right? Where they can come. We also have a physio facility where after a surgery in allopathy, they can go for physio immediately. Where we also have naturopathy, where in naturopathy, they can help with natural herbs and mechanisms to help in that person who's just got surgery recover faster. कभी सुना है आफ्ताब, sprains होते हैं, हम sprains होते हैं and injuries होती हैं, right? और injuries heal नहीं होती lifelong. क्यों नहीं होती? क्योंकि हम उसको वो टाइम और अटेंशन नहीं देते. हम गिर गए हैं, वो मेरा एंकल वीक ही रह गया है, एंकल ट्विस्ट हो गया, वो वीक ही रह गया. मेरे को बचपन में लगी थी, फिर मैं हील ही नहीं हो पाई इतने साल, वो वीक ही है मसल. सर्जरी के बाद क्यों रहता है वीक एक मसल, right? That is why you need all these sciences to work together. That's why in the hospital that I was naming, Bakson's multi-speciality, you can see all of this. They're all working together. And it really massively makes a difference, yeah. Massively. If I know that I'm popping antacids in my body, which are nothing but pills just for headache and gastritis, I'm ruining my gut health. आप जब research करते हो ना, तो ये देखना, गट माइक्रोबायोम जो बहुत चल रहा है, गट हेल्थ, गट बैक्टीरिया, ये सब बहुत चल रहा है. गट हेल्थ और गट माइक्रोबैक्टीरिया को जब आप स्टडी करते हो तो आप देखोगे जो इंसान हर दिन डिफरेंट वेराइटी के खाने खाता है उसका गट माइक्रोबायोम रिचर होता है. डिफरेंट वेराइटी क्या होती है? हैविंग डिफरेंट काइंड ऑफ वेजिटेबल्स एंड फ्रूट्स इन योर डाइट. कितने लोग करते हैं? योर गट माइक्रोबायोम इज रिचर वर्सेस इफ यू हैव वन थिंग ऑल थ्रू आउट योर वीक. It's not, your gut microbiome is not richer. And your gut microbiome reflects on your mental health, your physical health, your skin, you know, everything. Everything. And
now finally moving towards the end of this conversation, in the end, if I could genuinely ask you something, because you have pretty much answered all the queries that people usually have, what could be that one piece of advice for those people who are just on the verge, like they're about to fall to the trap of, being ill, or they are about to face this adversity? That could be cancer, that could be maybe they are very close to some heart related issues. Anyone who is just at the borderline of some very serious problems, what would be your piece of advice for those people?
Anybody who is at the borderline of falling sick, severely sick. Like that could be heart attack, that could be cancer, that could be just falling ill, having fever. What would be my advice for all of them? You have not fallen ill because of one thing. You have fallen ill because of a contributory factor of several things. Nobody at the age of 80 or 90 realizes the amount of weight they've accumulated, and their knee joints start hurting, right? So what you're weighing at in your 20s and 30s is not exactly what you're weighing at your 60s and 70s. Even though your bone density is less, but you're gaining more weight. So anybody who's at the borderline or the verge of falling sick, right, they should challenge what they've been doing for the last 30, 20, 10, 5 years of their life. Whatever is happening to you now is a result of what you've been doing in the last 10 years. Have you seen children fall sick just before they have an exam? Like they just fall ill, right? Have you seen somebody crash after a very big event? Like they have a week of overworking, night parties, late sleeping, everything, and they just crash. In 2 days they have a fever and there's no other symptom. No doctors can diagnose what this fever is, right? But why have they got a fever? Because they're exhausted. They've burnt out their body in the last 7 days. You don't get your sleep, you don't get rest. When you don't get rest, how are the cells going to rejuvenate and work on your body? Sleep is one thing, Aftab, that our generation lacks. We don't want to sleep on time. We want to see blue screens every night. What happens with that? We're not sleeping enough. If you're not sleeping enough, we're not giving our body the right kind of energy to heal. When we don't heal, what happens? We get sicker and sicker and sicker and sicker till that one borderline we get and we crash. Boom. One thing I ask my patients who, when I take their case history, how much do you sleep? What do you have? What did you have last night? What did you have before you felt sick? Before you felt sick for a week, tell me your diet. You fell sick on the 10th of September? Tell me what you had at least 3-4 days before that. How was your sleep? How was your diet? Where did you have food from? Everything. Everything. It matters so much. How much water did you have in your day? Did you have any stimulants? I have replaced and told my patients just one thing: start exercising. Their life has improved 40 times. 40 times their life is improved. There have been patients who come up to me for this skin condition. Give me a medicine. Give me a homeopathy medicine. It's safe. I'll take homeopathy medicine. When it's a lifestyle correction you need to do, I don't need to give you that medicine. Do that correction first. If it's not being corrected with that kind of lifestyle correction, I'm here for you. Lifestyle changes to karo. Karo to sahi. Why
Lifestyle changes first and then medical.
Then medical assistance, no?
Yeah.
It has to be hand in hand. It's like when we talk about the movies, we say the movies is a reflection of real life. The real life is a reflection of movies. What is your health? It's a reflection of what you've done and what you're doing. Simple.
Yeah.
No, nothing else.
I guess that was all from my side, Dr. Taniyaa. It was genuinely very enriching to hear so many facts, so many things about homeopathy and even medicine as a whole. I hope you enjoyed the conversation because I had a great time.
Thank you, Aftab. Honestly, the questions you asked me, every millennial, every Gen Z wants to know the answers. So I think thanks to you, they'll know their answers.
Thank you so much for that.